I'd like to call the Paramedic Services Committee to order. It is your responsibility to declare any pecuniary interest. There is none. We only have one information item, but call volumes. Michael.
Thank you, Mr. Chair. Mr. Chair, this document was pre-circulated, but I would like to highlight some items within the report to you. The transfer of patients from healthcare facilities, from one healthcare facility to another, is coordinated by the Ministry of Health Long-Term Care Ambulance Communication Centre in London. As a condition of the Paramedic Services funding agreement with the Ministry, Bruce County Paramedic Services is committed to provide transfer services directed by the Communication Centre. Depending on the acuity of the patient's condition, there are three options available for patient transfer. One of them is Orange, who can transport patients requiring critical care, the Bruce County Paramedic Services for patients needing primary care paramedics, and a third is a private transfer service which is currently contracted by the hospitals, and that is Voyageur. As the Ministry of Health continues to centralize medical specialists and centers of excellence, there'll be a continuing need to transfer patients to and from these facilities which are outside Bruce County. Further advances are made in the treatment of conditions such as stroke and coronary arterial blockages, patients who are treated today in their local hospital for these conditions may tomorrow need to be transferred directly to a facility in London or Kitchener so that they can receive the appropriate care or diagnostic services within the time periods necessary to decrease both morbidity and mortality. Paramedic Services is carefully monitoring decisions surrounding these potential changes, as the direct transfer of patients to healthcare facilities outside Bruce County would place increased pressures on the services deployment plan. Emergency transfer call volumes have fallen for the second year after a steady annual increase between 2012 and 2016. The volume of emergency transfers projected in 2018 is comparable to 2011 call volumes. Non-emergency transfers have decreased significantly over 7 years. The majority of these transfers are now facilitated by alternate means such as private transfer service, taxis, or family members. The number of emergency calls which the Bruce County Paramedic Services respond to has increased since 2011. Much of these increases relate to increases in seasonal populations, aging population, and an overall increased awareness of the paramedics profession and the services they can provide. Bruce County Paramedic Services call volume by community shows call volume increases for prompt and emergency calls, code 3 and 4, by lower tier municipalities between 2011 and 2018. The Ambulance Communication Center does send alerts to paramedic services when there are 3 or less ambulances available in Bruce County. Classified as code critical in the Bruce County Paramedic Services deployment plan, the 3 remaining units will be posted at Mar, Burgoyne, and Kinross to attempt to provide balanced coverage in the county until other ambulances are available. Based on Communication Center analysis between 2016 and 2017, Bruce County code critical alerts occurred 50% of the days of the year, with 65% of those times between 1900 and 0700. These events where there are 3 ambulances or less, These events where there are 3 ambulances or less are available to when they are available to respond. These conditions last an average of 135 minutes. The communications center is unable to determine how often and what severity of calls may occur during these periods. When this data is available, it will be a valuable indicator where and when these stresses occur. Paramedic Services is not aware of any condition or any occasion when there were no ambulances in the county and calls were waiting. Paramedic Services is monitoring response times and call volumes. Where the average response time has had an increase of 26 seconds between 2011 and 2018. The Department of Health Services Q2 report notes that the length of time from crew notification to the arrival to highest priority calls in the 90th percentile remains within expected norms. That's my report, sir.
Is there any questions? Go ahead, Mike.
Thanks, Mr. Chair. I guess my question, it must be pretty obvious that when we're in code critical, that will be the times when our response times will be longer than normal. That will drive up our average because we're at a bare minimum of resources here with 3. And so by this indication, that happens 50% of the time. 50% of the days in a year that happens. So it happens at least once. So I think that the information, I think it's pretty obvious that, and I don't think you're going to get away from those times when, when your earlier part of your report says we're likely to see our ambulances away from the county more often or longer periods of time. So that information that the control center is trying to accumulate, I think it'll be pretty obvious that those are the times that you are critically short is when you're at. And so, I think going forward, that's the type of thing that you need to address is you're going to need to put some more resources of it, make those available if you want to continue to put this, because if it's going to happen more often, your response times are going to just grow.
Mr. Chair, indeed, the times that this occurs in the evening are probably where there's less call volume is probably the reason the effect hasn't been felt as much. But indeed, it's if we have a period of time when we have 3 ambulances and very few calls, if that does change where we have more calls and very few ambulances, we will see increased response times, which you'll have now. At the same time, you may get to the point of calls waiting, but that we have not crossed yet. Sir?
So did they give any indication when that information would be available, Michael?
It's my understanding that they're bringing in new software that may see this available in 2019.
Okay. Yeah, it'd be good to know.
Go ahead, Paul.
Michael, on your in the report there, you talked about when we're critically low, where the 3 remaining ambulances position themselves. Down there, you talk about Burgoyne. Is there any chance that's a typo and you meant Elsinore? I see it at Elsinore all the time. I've never seen it at Burgoyne. Is that?
It's Burgoyne is in the deployment plan, sir, and I'm
Really?
confident. Yeah. There may be movements that are coordinated by the superintendent or the communication center, depending on when ambulances will be arriving back. So if there's 3 and we have ambulances outside the territory or not available, that's where they'll go. But it's a dynamic process, so they will move them.
Any other questions? Okay, well, that was for information purposes, so thank you. So item number 3, I need a move and a seconder on the act of recommendations. Moved by Janice, second by Mitch. All in favor? Carried. And our next meeting will be December 6th. We are now adjourned.
Thank you, Mr. Chair.